Good day, everyone. Welcome to the module on Introduction to NCCN Breast Cancer Guideline for Sub-Saharan Africa, which has been adapted to the Nigerian setting. I am Dr. Nafisat Ismaila, and I'm going to be giving you a brief overview of what to expect in this module. Further details of this module is provided in the printout which has been attached to this module. At the end of this course, we expect participants to have a better understanding of evidence-based clinical practice guidelines and how they are developed. We also expect a better understanding of the NCCN clinical guideline recommendations. Above all, we expect participants to be able to apply these recommendations to their individual practice. So what are evidence-based clinical practice guidelines? According to the Institute of Medicine, clinical practice guidelines are statements that include recommendations intended to optimize patient care that are informed by a systematic review of evidence and an assessment of the benefit and harms of alternative care options. There are different types of guidelines, the most common type being the evidence-based clinical practice guideline. This type of guideline is based on systematic review of evidence, and an example of this is the Clinical Practice Guidelines on the evidence-based use of integrative therapies during and after breast cancer treatment. The second type of guideline is the expert consensus-based guidelines. This type of guideline is based on the opinion of experts. It is less time-consuming and less costly. However, it has a lower level of applicability since they only reflect the opinions of developers. An example of this is the St. Gallen International Expert Consensus on the Primary Therapy for Early Breast Cancer 2017. The third type of guideline is the outcome-based guidelines. This type of guideline includes a measure of the effectiveness of evidence-based recommendations within the guideline to determine whether the recommendations improve the quality of care. Methods such as meta-analysis, decision analysis, or cost-effectiveness analysis may be used to determine the effectiveness of the recommendation. An example of this type of guideline is the early detection of breast cancer in Germany, an evidence-based, consensus, and outcome-based guideline, according to the German Association of the Scientific Medical Societies and the German Agency for Quality in Medicine. The last type of guideline is the preference-based guidelines. This type of guideline uses the methods of evidence-based and outcome-based guidelines, which are combined with patient preferences for possible outcomes of the interventions. This type of guideline is very rare and difficult to develop due to the need to include patient preferences or values, which can vary from patient to patient. We do not have an example for this guideline because of its rarity. However, many guideline developers include patient representatives on their panel in order to factor in patient preferences in the guidelines. Now we talk about the evidence source, which is used to develop these evidence-based guidelines. These sources are listed here according to their level of quality, and the lowest being the observational studies, which is followed by the randomized control trials and systematic reviews, and the highest quality being meta-analysis. And also, evidence-based guidelines can then inform clinical pathways, can inform policy decision-making, and can also inform drug funding. The guideline development process can vary from one guideline developer to another. However, there are some steps in the process that remain standard. The timeline can also vary. It can take a minimum of 1 year to a maximum of 3 years to develop just one guideline. This usually depends on the topic, the available resources, and the content experts' availability to contribute to the guideline development. Here is a brief overview of the guideline development process. This usually starts off with the topic of interest or a disease of interest, and then the expert panel is assembled. This expert panel comes together to develop a project protocol, which is then used to guide the systematic review of evidence. When this evidence is available, the recommendations are now drafted, and then the manuscript of the guideline is also drafted. This manuscript can then be submitted for publication in a peer-reviewed journal. An ideal guideline development panel must include the following: You need the topic content experts, which can be medical oncologists, radiologists, surgeons, depending on the topic in question. It must also include a guideline methodologist, a patient representative, a community clinician, and any other representation that is relevant to the topic. Now to talk about the NCCN Breast Cancer Guide. The primary goal of all NCCN initiatives is to improve the quality, effectiveness, and efficiency of oncology practice. The NCCN Harmonized Guideline for Sub-Saharan Africa is one of such initiatives. Although this guideline is very comprehensive, it's a very comprehensive evidence-based guideline document that targets the sub-Saharan African population, it may still appear overwhelming to an average primary healthcare physician in Abia State. So, to help understand the NCCN guidelines, you need to understand that the guideline is written by dividing the patients into different subgroups. So we have the non-invasive breast cancer patients, the invasive breast cancer patient, and the special cases. You also have to understand the algorithm and how it flows. The algorithm usually starts with the workup of patients, the diagnosis and staging, the risk reduction or primary treatment, then the post-treatment, and then the surveillance and follow-up. There are also some color codes included in this guideline that you need to understand. The black text usually indicates that intervention is a generally available standard of care. The gray text informs us that the intervention is either of optimal care or is highly advanced, and it may be costly or it can be technically challenging or have a lesser impact on oncology outcome. While the blue text denotes that there are regional options that may be considered when availability precludes general standard of care. A typical context will include a patient walking into your office and complains of symptoms of breast cancer. You now take a detailed history and examination and decide on the next steps to take. So, different phases of this patient cancer journey can be found in the NCCN guidelines. The NCCN guideline provides recommendation for each of these phases and helps you with the treatment plan. Details of this recommendation can be found in the printout included in this model. So in conclusion, the burden of breast cancer disease in Nigeria is on the rise. Healthcare providers need to be equipped with adequate knowledge and technique in treating cancer patients. Clinical practice guidelines are needed to provide appropriate care to these patients, and we hope by completing this model, healthcare providers will be confident in diagnosing, treating, and the follow-up of breast cancer patients. If you wish to get more information on the NCCN guideline, you can do so by clicking this link. Thank you so much for taking part in this model, and I wish you all the best.